Welcome to a continuing education presentation by VetStem Biopharma. My name is Bob Harmon, and I will be your guide this morning through an inside look at regenerative medicine and the feline patient. What do you tell a cat owner when their pet has chronic non-responsive inflammatory bowel disease, or perhaps non-responsive stomatitis, or maybe worse, they still have stomatitis after full mouth tooth extraction? What if their cat has really bad osteoarthritis pain, but they have high liver enzymes, limiting your options for pain medications? What if there's a kitten sitting on your exam table that already has dry eye and you need to discuss lifetime eye drops? What about a non-responsive anemia? These are all cases that you have a tough time because we don't have or haven't had any really good options for therapy in these cases in the past. So what is regenerative medicine? This video is just a simple demonstration of regenerative medicine in the flesh. Really, this is what we're trying to do. We're trying to put this phenomena of healing into a bottle so that you have harnessed regenerative medicine for your patients. So really, what are stem cells? Stem cells are primitive cells. They're present in almost every tissue, and based on VetStem's experience over the last 17 years, they're in nearly every species. We've done now 31 species, including marine mammals and including some reptiles. So these cells are in all tissues. The original thought was that because in vitro we could differentiate these cells into many tissue types, like tendon, ligament, bone, that was their main method of function. So this picture on the right is a petri dish showing cardiomyocytes that have been differentiated from stem cells. Without any electrical stimulation, and without any signals other than the chemical signals in the media, these cells aggregate and beat. So this really was quite striking and led us down a pathway which maybe wasn't quite the whole story. Stem cells really are injury-specific, perfectly choreographed pharmaceutical factories. They're adaptive. None of the therapies we as veterinarians or as human physicians have are really adaptive therapies. They may be designed for particular use, but they're not adaptive. Stem cells, on the other hand, are much like a paramedic. They show up with a bag full of drugs and devices and capabilities, and they adapt based on what they find. So what about mechanisms of action? How do these stem cells, how do they function in an adaptive kind of environment? So they really are parasites, Pericyte, and they're around all blood vessels, which mean they're in every tissue. When there's a local signal, these cells come off of these blood vessels, either by injury or by signal, and become activated, and they produce many growth factors, cytokines, commonly called trophic factors. So, for example, these cells produce an opioid agonist. They also produce a cytokine called interleukin-1 receptor antagonist, and those block pain. So, in response to a signal, these cells can produce a pain drug. If there is cell regeneration needed, these cells will produce various kinds of growth factors like epithelial growth factor, insulin-like growth factor, or hepatic growth factor. And these cells act upon or interact with local progenitor cells, for example, in the liver, to produce more hepatocytes. The probably most common mechanism of action talked about with these mesenchymal stem cells that came from pericytes are their anti-inflammatory mechanisms, and it's one we commonly see. So these cells, when put in an inflammatory environment, will produce various kinds of cytokines like IL-10, IL-1 receptor antagonist that will downregulate an overactive immune system and an overactive inflammatory response. So they really are the central buffer. They are also highly immunomodulatory. So these cells produce various kinds of cytokines that are in the center of how the immune system reacts to all kinds of external effects, including what we typically have called in the past autoimmune or immune modulated diseases, such as MS or rheumatoid arthritis or lupus. And these cells, again, will help buffer and monitor the functions of the immune system. These cells produce cytokines like VEGF, vascular endothelial growth factor, that are highly angiogenic and cause budding of new blood vessels. So, for example, in an ischemic disease like a stroke or like a myocardial infarct, you need new blood vessels. These cells, when they sense low oxygen tension, will produce these growth factors that help blood vessel formation. These cells are also anti-fibrotic, so they produce various kinds of collagenases and drugs and cytokines that help block fibrosis, but also help in the remodeling of fibrotic tissue, for example, in a liver, for example, in a muscle. Quite surprisingly, recently, these cells have been shown to produce peptides such as LL37 that are highly antibacterial, antimicrobial. There's even some early data that maybe there's something produced by these cells that help manage viral invasion. Excuse me. These cells also home. I guess not surprising, because when you think about white blood cells will home to areas of infection and inflammation and invasion of foreign material, bacteria. These cells also home. They home mostly to inflammatory signals, but also to low oxygen tension, so in areas of ischemia. So before we jump any further into how these cells work and how we might use them, let's take just a step back and think about the legal environment. So I'll back up for a minute. You look at all of these functions. These are all claims, could be claims, right, around a cell. A cell is anti-inflammatory. A cell is antimicrobial. So that means that FDA may have something to say about how we use these. So we'll talk about what is currently legal activity. We'll talk about what kinds of stem cells should you consider using. What are the quality control measures that are really important, as with any new therapy, and what's the liability for you as a practitioner. FDA regulates all drugs used in veterinary and human medicine, including biologics. The U.S. Department of Agriculture, on occasion, will take the lead in a biologic drug, but those are primarily vaccines and immunomodulators. Although stem cells have some of the functions that you might think USDA would regulate, the USDA and the FDA have collaborated, and the FDA has taken the lead and has issued initial guidances on the regulation of cell-based products in animals. So the guidance is very clear that cells for a particular use to treat or diagnose a disease are drugs and are regulated by the FDA. The pathway is an investigational new animal drug application. VetStem has 3 of those currently, one for feline, one for equine, and one for canine products. Autologous use, meaning use of a cell back into the same patient, has low enforcement priority, and in fact FDA has allowed a lot of the autologous use to move forward as long as it's safe and as long as it's done in a rational manner under their guidances. Veterinary liability risk is there if you don't follow FDA guidances. VetStem has chosen to take the high road. We have a good tissue practices FDA compliant facility. We also have an FDA good manufacturing practices compliant facility, and we've been inspected by the FDA. We have 3 FDA investigational drug applications that are in progress. We have a very high quality control central laboratory, meaning you don't have to try to manufacture drugs in your practice. And that also means we have hundreds of standard operating systems and a quality control unit that we'll talk about. Anybody that you are potentially going to use as a vendor for a cell-based therapy or regenerative medicine therapy, make sure you ask these kind of questions and ask them about compliance. So in autologous cell therapy, let's think about the patient. In this case, we have a cat. The patient is also the donor, and so we need to harvest some tissue. You could harvest bone marrow or brain tissue. Almost any tissue has some cells, but fat has a huge concentration of these regenerative cells, and so we can take a small amount of fat from a little abdominal incision or sub-Q. It's shipped by FedEx to a laboratory, and as you can see in this picture, this is a high-quality control laboratory with hoods and environmental monitoring and quality control units. And then we process the cells, and it takes about between 2 and 4 hours, and we then end up putting the cells custom manufactured for this particular patient. So this is a little bit like a compounding pharmacy in that we make these cells from the patient's fat, and then we make the dose and the volume specific to the patient. We then FedEx them back to the veterinary clinic, and they're injected by you, the practitioner, into the recipient, which is the same as the donor. So Fluffy has given us fat, and then Fluffy gets cells back from her own fat to inject, for example, in this case would be into a joint for osteoarthritis. Hugely important, we have a cryobank with more than 40,000 samples now stored for the last 17 years, and again, 31 species, mostly dog, cat, and horse, where we store cells for the use in the future. Some diseases will be a single injection, and you may get a cure. Others may need chronic administration. The harvest to inject procedure is less than 48 hours. So these cells are coming back fresh. They're not being cultured, they're not being expanded, they're only being separated from the connective and adipose tissue to get these concentrated cells for use in your clinic with this patient. So stem cell processing, the actual processing we do here at VetStem requires quality control systems, sterility, so making sure you're monitoring that, validated procedures, certified trained technicians. Sidebar, this particular technician you see in the picture is one of our technicians processing samples here at VetStem. Takes 3 months before we allow them to touch a commercial sample. So this is not something that a vet tech can do with an afternoon or an online seminar. The processing takes a lot of time and a lot of monitoring. We have calibrated equipment, quality assurance inspections. We're also inspected by the FDA. Dose control we'll talk about next. Hugely important. So quality centric means you've got sterile areas for processing, sterile hoods, sterile packaging, and lots of monitoring. Cell counting, to me, as a practitioner, is the most critical step. There are people who will tell you, oh, you should do this in your own clinic. You should manufacture this drug, and which, by the way, is illegal according to FDA, in your clinic, but there's no way to do a cell count without a $25,000 specialized cell counter. You can't use your blood processing machine. So how do you know how many cells you're giving? There is a dose, just like anything else, just like any drug. And so if you don't know, how can you possibly make a decision about the proper therapeutic dose? So if you had a vial of drug on the shelf that the label had become obscured or fell off, there's no way you would use that drug without knowing the milligrams per mil or the concentration of the drug in this vial and use it with a particular dosing in mind. That's unimaginable. But stem cells, for some reason, people think, well, so I'll collect a bit of fat, process some cells, and if I have 2 joints, well, I'll just split it in half. If I have 4 joints, I'll split it in 4. It makes no sense, but it seems okay to some people that you don't know what the dose is. After some 20,000 animals and 17 years of doing this, we have a pretty good idea what the dose should be per the various diseases and for various sizes and species of animals. So, what conditions are being treated in this area of feline regenerative medicine? So, the big ones are renal disease, gingivostomatitis, inflammatory bowel disease, orthopedic injuries, and immune-mediated diseases. There certainly are more, but as you read the literature, these are the ones that will pop up and have publications by academic institutions and practitioners. So here we'll give you an idea of sort of the spectrum of the kind of feline cases that we've treated. The biggest, clearly, chronic kidney disease, but osteoarthritis, stomatitis, IBD have all had double-digit numbers of cases that we've done and done follow-ups and case reports and publications. These are exotic feline cases. Again, I think I teased you a little bit with that we've done 31 species. These are some of the species that are the feline species that we've treated. We've treated Florida panther, leopards, cougars, lions we've done storage on. In cheetahs, we actually have a really interesting program being presented next week at the American Association of Zoologic Veterinarians on liver fibrosis, where we've been able to show true reduction in fibrosis and blockage of progression of a fatal disease in the cheetah. So let's now go to the exam room. So now you have an owner that comes in with a cat with maybe one of these diseases we just talked about, and they're going to have all kinds of questions and all kinds of misconceptions from having heard about stem cells on TV or via the internet. So first of all, it's really important to explain to them this is your pet's very own stem cells. This is similar to taking umbilical cord stem cells that you might have saved for one of your children and now be able to use those in the future. Only thing is, we don't need to wait. We're using them now. Collections are routine surgery, again, kind of like a spay or a neuter, and that their pet's going to be treated within 48 hours, not some time in the future. Stem cells have been shown to reduce inflammation, regulate the immune system, improve quality of life, and modulate pain. These are sort of things that maybe not regulate the immune system for the owner, but reducing inflammation, helping them with quality of life, and reducing pain are all things they can relate to. Hugely important. These owners want to know they've got cells banked for future use. Every time we do processing of cells for one of the patients you send to us, we bank the extra cells for the future, and we've got 40,000 doses banked for some probably 15,000 different patients from the last 17 years, and we have treated even as long as 10 or 12 years after the initial treatment, have been able to pull samples out, quality check them, and use them to treat a patient for another indication or some progression. What about contraindications? There aren't very many, but the primary is patients with active cancer. And this is a little complex, so I'm going to take a minute. So there's no data suggesting that adult stem cells can become cancer, except in extreme laboratory in vitro conditions that we don't do. There is mixed data. If a patient has an active cancer, there's inflammation. There are some rodent studies showing that if you inject stem cells along with cancer cells, that it might accelerate the cancer. So other ones actually show that MSCs cause cancers to slow down growing and differentiate. So we don't know for sure. VetStem has taken a very conservative approach and recommend you don't treat patients if they have an active or recent cancer. So the attending veterinarian and owner can override this in discussions with our veterinarians here at VetStem if they believe the benefits outweigh the risk.
We hear a lot about stem cells these days. But what are they? Where do they come from? And how do they work inside of our bodies? In the last few decades, just mentioning stem cells usually invokes a strong reaction, especially embryonic stem cells.
It crosses a moral boundary that our decent society needs to respect.
Recent breakthroughs of adult stem cells may have done away with that controversy. Through multiple new therapies, they've been proving themselves to humans. But we're not the only ones that can benefit from this cutting-edge science. This is the journey of a cat, who seems to be the success story doctors hope for, and possibly holds the answer to the most common killer of cats: kidney disease. Kitters was born June of 1998 in Houston, Texas. Adopted at 6 weeks old, he and his human friend nurtured a special bond throughout the years.
It's Mission Cop, Officer Kitters.
Together, they relocated to Los Angeles in 2005, where they currently reside with their other animal friends: a turtle, a snake, and a few fish. In September of 2012, Kitters was diagnosed with chronic renal failure, or simply kidney disease. Kidneys play a vital role in our bodies, ridding our blood of toxins through tiny tubes known as nephrons. As kidney disease develops, scar tissue begins to form inside the nephrons, making it more difficult for the kidneys to filter out toxins. Once the kidneys are weakened, the animal becomes vulnerable to a number of other conditions, such as hypertension and anemia, among others. Unfortunately, CRF often goes undiagnosed, given that the symptoms of the disease do not begin to show until 2/3 of the kidneys are damaged. Kitters began showing signs of kidney failure at the age of 15, exhibiting classic symptoms: lack of appetite, excessive thirst, nausea, and lethargy. He was prescribed an unappetizing low-protein diet and ongoing administration of subcutaneous fluids for rehydration. This had been the standard treatment for decades, although it has only been shown to slow the progression of the disease, not reverse it. So is there anything that can help? Dr. Richter and his staff at Montclair Veterinary Hospital think so. In recent years, his hospital, as well as a few others, have begun using stem cells to treat animals with various orthopedic conditions, such as dysplasia and arthritis. The results? A 75% success rate, with noticeable improvements in 30 to 60 days. Which begs the question, if adult stem cells can repair the bones, can it do the same for organs? In October of 2013, Kitters would become one of the first cats to test that theory. He and his human friend made the drive to see Dr. Richter in Oakland for a 3-day surgical procedure in hopes of getting Kitters a new leash on life. Let's look at how stem cells work. Life begins with one cell, the fertilized egg, that divides over and over again to make up the body. As our bodies develop, most cells stop dividing and become specialized cells, maintaining specific areas of the body. Once these specialized cells are damaged, they need to be replaced, which is where adult stem cells come in.
Stem cells, as you probably know, are cells within your body that are able to turn into any other cell in the body.
So, what's the difference between embryonic and adult stem cells? Embryonic stem cells come from embryos that are 3 to 5 days old. These are considered pluripotent, meaning they can be programmed into any type of cell in the body and will divide indefinitely. Adult stem cells are considered multipotent, meaning they are able to become many but not all types of cells. Unlike embryonic stem cells, the use of adult stem cells is not considered to be controversial, since they are derived from various tissues of the developed body, most commonly bone marrow and fat.
Kidder has some kidney issues. So what we've done is we harvested some fat from his abdomen, so it was a surgical procedure, and we sent that to VetStem in San Diego. And what they do is they isolate the stem cells from that fatty tissue, they concentrate them, and then they send them back to us. And in the case of an animal with kidney disease, what we do is we just give them intravenously. And what that's going to do is that's going to begin that healing and rebuilding process.
Just as embryonic stem cells helped grow our organs before birth, adult stem cells can grow new tissue in damaged organs as adults.
Good job, kidders.
So the nice thing about stem cells, a couple of nice things, but the biggest one is there's really no issue as far as tissue rejection goes, because they're Kidder's own stem cells, so that's not a problem. And not only that, because we're giving it intravenously, if there is anything else going on in his body beyond the kidneys, it's going to address that as well. So it's a really, really wonderful sort of systemic treatment.
Kidder's human friends are hopeful that stem cell therapy will become more common in the coming years, as we saw with the rise of holistic treatments, which Dr. Richter also practices. His rehabilitation center specializes in combining Western and holistic medicine for animals.
If we have dogs that are super sore, as you might imagine, asking them to do exercise and rehab therapy, it could be painful. So the obstacle course is all about getting a treat or playing with the ball or whatever it is that makes the individual dog sort of happy. Huge, huge benefit, and it's just amazing to watch how quickly they get better.
Two weeks later, Kidders received a second injection of stem cells. After 35 days, Kidders was on the mend, and his condition began to visibly improve. His human friends noticed his appetite and energy returning with a renewed spirit. The numbers showed improvement as well. Aside from treating animals, stem cells have the ability to reduce and reverse a variety of conditions in humans. In 2009, President Obama signed an executive order that would pave the way for modern-day treatments.
We will lift the ban on federal funding for promising embryonic stem cell research.
Currently, over 60,000 people a year around the world are benefiting from stem cells. Treatments for cerebral palsy, multiple sclerosis, leukemia, spinal injuries, diabetes, and heart disease are already available and changing lives. With more new scientific breakthroughs on the horizon, stem cells are promising to revolutionize 21st century medicine, just as antibiotics did in the 20th.
So that's Kidder's story, told from an owner's perspective. So there's no magic in stem cells. These cells reduce inflammation, reduce scarring, help stimulate blood flow, things that would be needed in a damaged kidney case. This is a case series that we did of approximately 40 cases, average age 12.2 years, quite a variability in age, an average dose of about 5 million cells given intravenously, as Dr. Richter showed in the video. The initial number of doses, 1.8, some cats got 1, some got 2. Total doses during the time we followed them, again, average out for some period of time, of 3.3 doses. These are the pre and post follow-up data on two of the key parameters, not the only thing we follow in cats, but blood urea nitrogen, BUN, and creatinine, both that should be at a lower level, and in kidney disease, rise. So the BUN was over almost 62 pre-treatment. At 180 days, it had dropped to 52. It's a 16% improvement, and almost a year later, had now started to climb back up. These cats were ones that didn't get repeat ongoing treatment, which we believe now needs to be done, but it showed you can have an initial, certainly a benefit from these kinds of therapies. Now we routinely advise owners to treat at least twice a year, and maybe more often depending on the severity of the disease. And here, the creatinine, which was nearly 4, dropped down to 3, 25% improvement nearly, and but then started climbing back up. So the survival rates are really interesting. These are obviously affected by the owner's willingness to continue giving therapy such as sub-Q fluids and other things. But in looking at the literature on the far right, the survival rates with a minimum 2-year follow-up, once they got the stem cells, we saw a higher, against small numbers of animals, but we have certainly a higher survival rate than that reported in the literature. We now have an ongoing clinical trial, blinded, placebo-controlled, real clinical trial running at the Animal Medical Center in New York, and hope to have good long-term data from them. So let's switch our gears for a minute and talk about feline gingival stomatitis. This is a horrible disease for the cat and, of course, for the owner. You get this really bright reddish inflammation in the mouth. It's an autoimmune or immune-mediated disease. We don't really know exactly what goes on. Sometimes removing all the teeth helps, but certainly not in all cases. And this was a study presented from UC Davis in 2015. If you look at the pre and the post, substantial differences in reduction in inflammation in the 7 cats on the right. So 1, 2, 3 of them had 100% remission. 2 of them had a 2/3 approximately, and only 2 cats didn't respond. And these were cats that had already had all of their teeth removed and still had severe gingival stomatitis affecting their life. So in our approach to gingival stomatitis, you certainly need a diagnosis of gingival stomatitis. The animals need to be healthy enough for fat collection, and except for the gingival stomatitis, they're otherwise reasonably healthy. You have to assess. You're going to do an anesthesia to collect some fat. Are there risks there? Also, cats that don't have active cancer, tumors of unknown origin. So the recommended treatment is the dose freshly isolated from fat, creating what's called stromal-vascular cells, or SVF, and bank cells for the future. The volume is 5 milliliters. It's given intravenously with a hemonate filter, and we give 2 injections approximately a month apart. We believe this gives us the best chance to get a good remission in the inflammation from the stomatitis. The retreatment plan. So, unknown for any individual animals. Minimally, you can wait until clinical signs return and then use some of the bank cells that you've stored. If you want to be more aggressive and really try to assure that it doesn't come back, an additional IV dose every 90 days could be done. In the small print at the bottom, we concur with both UC Davis, Animal Medical Center, and other veterinary schools that using diphenhydramine subcutaneously prior to administering IV stem cells helps reduce the chance for any reaction. So this is a simple case, but Beans was a domestic short hair, 2 years old, pre-treatment, chronic, severe lymphocytic, plasmacytic stomatitis. Most all of its teeth were already extracted. Post-treatment, and this is a 2-treatment series, no lesions, appetite normal, normal salivation. Obviously, the owner would be happy with this kind of an outcome. We also often try to reach the patient before their teeth are extracted, because you may not have to go through that fairly severe procedure. So let's talk about IBD. I'm going to show a picture of canine IBD of a nice study done in Europe, beautiful study done in Spain. This was a single IV dose of adipose stem cells. No drug therapy was allowed, no adverse events, with an 81% remission. And here were 11 dogs that were treated, and these are the two scoring systems, fecal scoring systems used for IBD. And you can see even within a 42-day time period, they came back down to near normal. So for diagnosis and case selection for IBD in the cat or the dog, certainly ruling out food allergies, GI bacterial and viral diseases, GI parasites, those have been ruled out as a primary cause. Biopsy really is required to rule out lymphoma because, one, the cells aren't going to treat it, and potentially it could even make it worse. The animal is healthy enough for adipose collection, and except for the IBD, the animal is otherwise reasonably healthy. Also, the animals don't have active cancer. We've looked at lymphoma or any other cancers, of course. The recommended treatment is a dose of freshly isolated stromal cells or bank cells. Again, these are the adipose stem cells that are extracted freshly. Volume of 5 mils, intravenous. Can be a single or double dose protocol. The Spanish study in dogs was a single dose protocol. Our experience is that a double dose protocol, 2 to 4 weeks apart, might be more effective, but there's not good published data. And the retreatment plan, again, you can wait till clinical signs return. They may not return, or you can be aggressive and treat as often as every 90 days with an additional IV dose. Again, we follow the UC Davis and AMC recommendations for diphenhydramine and also the administration rate. So this is an interesting case study. So Lovey is a Himalayan, 4 years old, female spayed. History, healthy up to September 2008, and then given her monthly flea prevention application, had a significant reaction to that and developed an appetence, vomiting, diarrhea, rapid weight loss, had really lost about half her weight, and was taken to a specialty center. The differential diagnosis was lymphoma, IBD, foreign body. Obviously, it could have been some of the dietary, but with the rapid onset, probably not with no diet change. Endoscopy was performed, and the diagnosis was made of IBD from the endoscopic biopsy. Feeding tube was placed, and at the same time, fat was collected for potential use in stem cells. A single dose of 3 million stem and regenerative cells were given intravenously 5 days after the endoscopy and placement of the feeding tube. Within 2 days of receiving the stem cells, the feeding tube was removed. As appetite had returned, vomiting and diarrhea had stopped, and the patient steadily gained her weight back. None of the symptoms reoccurred, and Lovey lived to be a 13-year-old cat. I know this case quite well because this is actually our personal cat at home, and it was the first one we had actually treated with a possible diagnosis of IBD, and so we are now quite excited about the possibilities for other cats. So I'm going to go through a couple of papers now. Feline osteoarthritis is an odd disease, right? It's difficult to diagnose because cats are rather stoic and don't demonstrate the typical pain that a dog or a horse might show. So in this study, radiographs of 100 cats more than 12 years old taken as part of a diagnostic workup for multiple reasons were retrospectively reviewed, and 90% of them showed radiographic evidence of DJD. When the medical records were examined more closely, only 4 contained any mention of DJD, but obviously severe DJD of the vertebral column was sometimes associated with neurologic signs, was seen in many of these cases. The key question from this study was, did the failure to observe clinical signs truly represent a lack of clinical signs in the presence of radiographic findings, or a failure to recognize the signs? This was the DVM360 article from 2008. Also, in a recent study, prevalence of radiographic signs was 33.9%, prevalence of clinical signs 16%, with most affected cats being 10 years or older. So again, half the time you don't get clinical signs, at least that are reported. Elbow joint, most commonly affected joint in some published studies. However, when OA rather than DJD is specifically described, the hip joint was most frequently affected. Many cats have affected joints that are in multiple locations, and bilateral is very common. Again, this is a DVM 360 article from 2008. So how are the stem cells applied in orthopedics? Well, what reasons? Well, first of all, they're applied by intra-articular injection. Intravenous administration is commonly used, but most often in conjunction with intra-articular. But if you have very widespread OA or difficult areas to access like the spine, IV might be the preferred route. The stem cells are applied really looking at three primary areas: the improvement of quality of life, obviously reducing pain and disability, hopefully reducing progression of the degeneration happening in the joints, and to repair specific damage such as cartilage erosion or other tendon and ligament locations. Orthopedic use generally requires multiple doses over the lifetime of the patient. Occasionally, we do see a single treatment in a patient last many years. The average is about a year and a half. But generally, with a degenerative disease like this, you expect that you're going to see reoccurrence of the pain over time. That's why it's wise to cryobank part of the initial cells for use in the future. Most patients' disease progresses through the original causes. Could be confirmation, could be just wear and tear. What are the risks and benefits? First, what are the potential risks of cell therapy? So autologous cell therapy, so generally the cells themselves are not considered to be any significant risk, but there is an anesthetic risk for tissue collection or for joint injection. Infection due to contamination, if the product's not processed in a clean laboratory, or potentially you can also, during a joint injection, carry a bacteria in. And reaction contaminants in the cell product. If the laboratory that you use does not have procedures designed to remove contaminants such as endotoxin or foreign proteins or bacteria, that certainly could be a risk. Possible benefits: reduced pain and inflammation, slowing progression of the degeneration, improved mobility, appetite improvement, and weight gain. These sort of taken together are really an improvement in quality of life. So this is a short journey through the data that Vestem Biopharma and its scientists have collected over the last almost 17 years now. Stem cell therapy is not just in the future, it's here now. Fewer cats are treated clearly than dogs, and I think that's partly because of the diagnostic dilemma of diagnosing osteoarthritis, but many people now are asking and starting to use cells for things such as gingival stomatitis and renal disease. Our laboratory is FDA compliant. We're inspected by the FDA. There's no equipment to buy, so you aren't trying to train your veterinary technicians to be stem cell technicians. And there's very strong veterinary technical and marketing support. Veterinarians helping veterinarians help pets. Start today. It's easy. We've got multiple of these CE presentations you can take online. There's no charge for them. This is intended to educate all of our partners in trying to deliver this therapy. Thank you very much. Again, this is Bob Harmon with VetStem Biopharma.